Hi everybody, it's Professor Tadone, and I'm going to go over with you the clinical assignments for this course. During this course, you will have 3 different clinical assignments. The first one you will see is it's in your Moodle page, and when you scroll up to your Moodle page, go down a little bit until you see Assignments, Guidelines, and Examples. And down here, you will see your 4 hours with the discharge planner. This is due week 8, but it can be done anytime during the course. Just so you know that you will choose a discharge planner, and you will spend 4 hours with that person. During this 4 hours, you'll be filling out a grid to state what you're seeing during that time with the discharge planner, what you're learning, what you learned that you did not already know, and any other information that's on the grid for completion. You will also get a signature from your discharge planner, and that looks like this when you open it up. And you'll put your name here, your cohort number here, the date submitted here, the name of the discharge planner along with that person's credentials, and then that person will need to put his or her signature on this line, and your discharge planner will fill this in. Okay? So the discharge planner fills this section in, and all you need to do is 4 hours with the discharge planner. Some people do more, but you cannot do less, so 4 hours minimum. The discharge planning grid is right here, and this is what you'll need to fill in for your log for when you're spending your 4 hours with your discharge planner. You're going to put the date you're with that person, the time from and to, and the location. And then right here, you're going to put a detailed description of activities noted during your 4 hours. And then you're going to put a second part. What did you learn that you did not already know? And that's important, so you're going to need 2 parts. First, a detailed descriptions of the activities noted during your 4 hours. And then, what did you learn that you did not already know before? Okay? So that's your discharge planning log. You do not need a signature of the discharge planner here because we have that on the separate page. But you can put down here the name and credentials of that discharge planner. But you do not need the signature here. That goes on the separate signature page. Once you've completed these, you're going to scan them and put them in the Dropbox in week 8. And that's way down here. So you scan those and put them in the Dropbox here. There's one Dropbox for the signature page and a Dropbox for the clinical log. The next thing you're going to is 24 hours with a community practice experience with an RN preceptor. Now, I will already have worked with you to discuss which RN preceptor you're going to be with and where when you sent me your recommendations or work to get those done. If for some reason COVID is disallowing face-to-face visits during January for this preceptorship, we do have a backup plan for simulations, but this can only be done when the state approves it, and it can only be done if we're disallowed face-to-face visits. So we'll hear more about that if we have to, but let's assume you are doing face-to-face visits. This is the clinical log you're going to be completing. And you'll put your name here, your cohort, the date that you're submitting this grid. You're going to put down here how can you use this information in your nursing practice, and you're going to put your response here in 1 or 2 paragraphs. And then for your clinical log, some people do their 24 hours over the course of several days. Some people do it over the course of, but the days you're going to have to put each date, the time you arrive, the time you depart, and that needs to add up to a total of at least 24 hours. You're going to put the activities you noted. What did you see your RN preceptor do? What did he or she do with the patients or for the patients? What you learned during this time and how you helped. You will need to help out at some point during this clinical experience. Now, even if that's just taking vital signs, that's fine. Or if it's asking questions or triaging, that's fine too. However, you help your RN preceptor, and it has to be helped sometime during this time. It does not have to be held for the complete 24 hours because usually what will happen is the RN preceptor will prefer to show you what to do first before you do it on your own. And when you do help, you're going to be with your RN preceptor. Once you've completed that and the signature page for the RN clinic for this log, you're going to go down to week 8 and you're going to put in your signature page for the CPE preceptor, and you're going to put that in there just like you did for the discharge planner, and you're going to be putting in your log for the CPE. Now, if you are not having a CPE face-to-face, you will get directions what to do for simulation studies. What you need to do for your clinical experiences is you are going to go to 2 different agencies or resources and interview a person of knowledge at each of these places. This needs to be done by week 8, and we will be discussing these during week 8. So what you're going to do is, if you choose, there is an interview tool here. You can choose to ask questions off of this for the person that you're interviewing. When we reach week 8, you will be discussing what you found out at each of the different places you went to with the class. That way the class will have a really neat knowledge of all these different community and agency resources available. If you choose, and you do not have to do this, but if you want to, you can create a PowerPoint for this and present it to the class week 8. And right here is where you would put that in the Dropbox. And as I stated, you don't have to do a PowerPoint. Many students prefer to, so that's where you would put that for your 2 community agency interviews. Otherwise, it will just be a verbal demonstration and presentation for week 8. Those are assignments that you have to complete sometime during this course. Well, for now, if you have any questions, please let me know, and I will see you soon. God bless.